I'd like to sincerely welcome Deputy Donnelly to his new role as Minister for Health. In opposition, he was both insightful and constructive, and I hope and expect that, the Minister will bring that insight and expertise to the continuing reform of our health services. I'd also like to take the opportunity to thank Minister Harris for his service. I think the real character of a man is sometimes revealed when he's under stress, and obviously the stress was unique during the pandemic. We're here today to assess the additional budgetary requirements for the health service for the remainder of 2020. We recognise also that, apart from the pandemic, there continues to be underlying pressure on health service costs arriving from inflation in a variety of areas, including drugs, salaries, high-tech diagnostic and treatment options. Clearly, we are today examining a large incremental budget from the health service. We recognise that the structure of the budget and the way it is reported makes it difficult to scrutinise this ask in great detail. Paul Reid is on record on multiple occasions saying that he expects to be in front of subcommittees in this House explaining and defending the additional HSE funding, and we look forward to having that opportunity to investigate that further. So I'd like to ask the Minister to confirm that it continues to be our intention to engage with the HSE on the detail of the incremental COVID spending, while recognising the reality that much of the expenditure was battlefield spending, with decisions rightly made at great speed and sometimes not with the level of scrutiny we would have applied in normal times. Clearly, this is going to the additional expenditure on PPE is going to represent a major line item for the HSE for the foreseeable future. It's absolutely right and appropriate that we seek to protect our frontline health personnel. We have all stood at our front doors and clapped for our frontline workers, but sufficient investment in PPE is the first and most practicable way that we can demonstrate that support. So I'd like to ask the Minister about your view on the likely longer-term trajectory and strategy as it relates to PPE. Does he expect it to be a permanently substantial budget line item? And assuming yes, does he have a view on how we should optimise the longer-term supply chain for such PPE? So specifically, should we negotiate longer-term arrangements or options for international supply, or should we seek to build national capacity and/or a national stockpile of PPE? And of course, we do this with our oil reserves. Should we be doing the same thing with PPE? We all watched with bated breath as airplanes took off from China carrying emergency supplies that we didn't really have time to check through, and not all of it suited. And I think that having a long-term strategy about how our PPE supplies should be kept in reserve, how they should be delivered, should they be manufactured in Ireland, I think that's all very important. Another major item in the budget reflects the costs incurred in securing private hospital capacity as an insurance policy against a large surge in acute or ICU capacity during the pandemic. I'd like to note our support in government for this initiative, as we voiced our support when we were in opposition. The open book accounting arrangement was a reasonable way to conduct the transactions at short notice, and it should be no surprise to anyone who has read these budgets that the costs of owning and running a major acute hospital are substantial. I think that having this kind of surge capacity access going into the future will be a major asset in our strategic pandemic planning. So I'd like to ask the Minister, what is his view on whether and how we should continue to hold an option over exercising a similar, fair and fairly compensated takeover of private hospital capacity during any future pandemic? I note that the original 2020 operating metrics, targets and service level agreements have not been updated in this estimate to reflect the impact of the pandemic. And this is completely understandable. The Parliamentary Budget Office considers the failure to estimate the impact of the pandemic on existing metrics and context and impact indicators to be a matter of serious concern. So I can understand this sentiment, but not in the short term. Clearly, the fact that normal business, including most medical business, was suspended for 4 months means that some targets will inevitably be missed by a wide margin. I do not, however, think that it is fair or reasonable to expect that the Department of Health and the HSE should have fully updated their metrics by now, for 2 reasons. First, we're still in a pandemic. I think it's fair to say that all of our health professionals, including the administrative staff, continue to be focused on saving lives rather than updating metrics. Second, even if they were to attempt a short-term update, the huge uncertainties would render such updates completely meaningless. We just don't know how outpatient-inpatient diagnostic rates will be affected as we emerge from the pandemic. Guesswork in the guise of diligence is not helpful. That said, over time, we do want to ensure that both the meaningful metrics in the light of the steady state post-COVID situation are defined, and that the structure of the health budget and the vote is changed so that it's amenable to meaningful and transparent scrutiny in this House. So can I ask the Minister, will he commit to updating the performance metrics for the different programme areas for the 2021 financial year? And will he investigate how we might be able to restructure the reporting of the budget in future so that we can more meaningfully scrutinise it? Thank you.
Minister, could you deal with those questions, please?
Thank you, and I'd like to thank Deputy Smyth for his contribution and questions, and I'm really looking forward to working with them. The structure of the estimates is difficult to interpret. I agree, and I've been on the record for many years on this, and I think we do need to find better ways of providing the information to the Oireachtas. It is one of the Oireachtas' most important roles, is to hold government to account on the money that it spends on behalf of the Irish people. I struggled in opposition for years with interpreting this information, and so yes, absolutely, I am committing to working with the officials, working with the HSE to improve that. I think the establishment of the Parliamentary Budgetary Office is very useful, but I think there's a lot more can be done. I think there's a lot more should be done, and it is contained within the programme for government as well that this is something that would be looked at. Will the Oireachtas, Deputy Smyth has asked, have the opportunity, I think was the question, to engage in more detail on the extra spending? Absolutely. I will make myself available. I've no doubt the officials will, and the officials within the HSE. So if the Oireachtas or the Dáil or the relevant committees want to engage in that, there would be no issue. And as I said in the speech, Ceann Comhairle, or Chair, I will be back before the House seeking additional funding. This €2 billion is for measures taken to date to deal with COVID, and there is a lot more that is going to have to be done. My view on long-term spending on personal protective equipment: do we need to build a national stockpile? Do we need to increase domestic production? At this point, I would say all options need to be examined. We certainly do not want a situation in the future where there is a second wave or a different public health outbreak where we are scrambling to get planes in from China. I think given where the health system was, I think the HSE do deserve enormous credit for what they did and how quickly they responded. But we don't want them in that situation again. So I think all options have to be on the table. There was a question asked on private hospital capacity. Do we continue to hold an option during the pandemic? Well, the private hospital contract ends today. It worked. It was understandable why it came in. There were issues raised by me and other members of the House, obviously, during the contract. The reduction in capacity in the public system caused by COVID-19 is immense. We may need to leave 20% of beds vacant. People involved in scopes are saying capacity could be down by 50%. I heard one figure of 80%. Surgeons are saying in some cases they can do half the number of surgeries. GPs can see less people. So our public health system is facing an unprecedented crisis, triggered by having to respond to COVID, but actually a challenge at, I think, the same scale is having to now provide care, non-COVID care, in a COVID world. And again, I think we're going to have to look at an awful lot of options. The goal, however, is not to have dependency on private providers. The goal is universal health care provided through the public system. But in the short term, the public system has just lost a vast amount of capacity, and our obligation is to make sure that people can get access to health care. But not even the long term, the medium term goal is that we transition as quickly as we can to full capacity within the public system. Thank you.